Okay. Well, welcome everybody to the Evans Center Spirituality Colloquium. We have two guests that I get to introduce today. For those of you who may be watching this online later on, my name is Alex Lyon. I am a pediatric neuro-oncologist at Riley, and I'm the Associate Director for the Evans Center for Religious and Spiritual Values in Healthcare. And so I want to introduce two colleagues today. I'll start with Reverend Lynel Beaty, who was born in Henderson, Kentucky, raised in Evansville, Indiana by her late parents, Reverend Dr. Anthony and Alice Brooks. She is the youngest of four. Lynel's married to her husband, Tim Beaty, for 33 years, and they have two adult sons, Tim Jr. and Michael. She also is Mimi to three beautiful granddaughters, Layla, Nyla, and Marley. Lynel is a board-certified chaplain through the Association of Professional Chaplains, has been so since 2012, and currently serves as an associate minister at her church. She has earned her BS in Business Education from Central State University, Wilberforce, Ohio, her MDiv from Payne Theological Seminary in Wilberforce, and is currently working on her doctorate in ministry at Christian Theological Seminary in Indianapolis, Indiana. Lynel has been serving as a leader within spiritual care for over 6 years, and what she enjoys most is seeing her team flourish. I want to also introduce Kelsey Miller. Kelsey is the project manager for the Department of Clinical and Organizational Ethics for the IU Health System. She is also the developer and the program manager of the Family Support Program, which provides services and supplies to family members of actively dying trauma patients. She completed the Fairbanks Fellowship in Clinical Ethics in 2022, as well as received a master's in healthcare administration in 2021 and a master's in leadership development in 2022. Kelsey is married to her husband, Chris, and they have 2-year-old twin boys, Hudson and Maddox. Kelsey enjoys being outdoors, traveling with her husband and children, professional sports, reading, and is a huge fan of true crime podcasts and documentaries. So welcome, both of you. We're excited to hear about your value grants projects. And I will turn this over first to Lynel.
Thank you, Alex, and good afternoon, everyone. And I am going to share my screen. Can everyone see that? All right, so first thing okay. Whew, sigh of relief. Well, thank you again for the opportunity to share an update on the grant that we received from the Evans Center. And so this grant is the Tranquility Cart Support Cart. And all right, so just a quick agenda of my time today. I'll do an introduction of the project, the plan, determining outcomes, importance, and innovation, how this project is in alignment with our IU Health values, challenges that I've encountered thus far, and the learning, and then I'll save some time for question and answering. And so the project, the Tranquility Support Cart, is to serve to supply team members at the Adult Academic Health Center, to be utilized as an additional resource that chaplains can use to provide staff support, And this staff support can be when a traumatic event takes place, or when the staff chaplains feel that the morale of their unit interdisciplinary team colleagues could use uplifting. And I will say that the grant amount that we were approved for was the first year $4,000, and then for the second year $3,000. And to date, I've spent a little bit less than $800 on supplies. And yeah, so let me go to give you a quick preview of a couple of the supplies that we do have currently. Wait a minute, I'm sorry, I'm going too fast. Hold on. All right.
Technology's half the battle.
Yes. Not always my friend, but okay. And so to give you a little bit of information before I show you the supplies again, the staff member care cart, the Tranquility cart, is going to be utilized at the Adult Academic Health Center at both Methodist and university campuses. And it's our staff chaplains regularly come face to face, sometimes doing the most traumatic events and experiences that their colleagues often are faced with. And so one of the small things that we can do to help, hopefully help alleviate some of their emotional burden is just to provide an opportunity for a team member to be valued and recognized, that we see that you have done awesome work. We also see that you might need a little uplift today. And so this cart will be supplied with self-care items and resources that we can also provide to our team members. And so some of those supplies, little booklets with pens that have inspirational words on them. Also, of course, snacks. Always good to have snacks, chocolate, as well as popcorn or protein bars. So a different variety of snacks. And also in the small bottles, these are essential oils. And so we were able to get a collection of essential oils, and then inside the little blue pill bottles are samples of that. They're on cotton balls inside. And so the staff could actually just keep the bottle in their pockets. And if they need some calming, then they have it right there. Additional supplies are stones that also have inspirational words on them, and stickers. And last week, one of the chaplains said the stickers were a big hit on their unit. And so the cart is available, like I stated, with the different items on the carts. And so there are items for both. The same items are on both campuses, both at University and Methodist. So the sole project objective of this cart is to provide the self-care items to team members during a difficult shift or any other event that the staff chaplains may deem necessary. And it is our hopes in doing this that it will improve the emotional health and well-being of our team members. One of the things that I would like to state today is that in 2020, Spiritual Care partnered with the administration department to implement a care cart program. And that initial funding for that cart, it has been utilized. And now we were so grateful that we were able to get this grant so that we could continue that support to our team members. One of the teams that has been greatly impacted by the care cart previously had been the trauma team at Methodist. And some of the things that we have heard from team members states that when the chaplain brings the cart around, it shows them, one, that we are listening and that we care. Chaplains have shared that the smile or excitement that they see when coming around with snacks or chocolate after a tough shift or a difficult code, it really makes them feel not only that they're valued, but what they are bringing to the team is also a value for their team members. Importance and innovation. And so we want to be intentional with how we care for those working beside us. We want to make sure that our IU Health values are honored. And we want to also state that a small token of recognition of a hard day or just a moment of gratitude can really go a long way. It's amazing how just saying, I see what you're going through, may this pick you up today. The smile that you receive and the acknowledgement that you receive when that happens, you really I can't put that into words adequately enough to state just how important this project is. But it's for us, like I stated, to be intentional with how we care for those that we work beside. Compassion, purpose, excellence, and team are all IU Health values that we try to honor and continue to meet each day. It's a wonderful thing when our colleagues and those that we work beside us, when they see that they're valued, and how this care cart can even if it's a small token, it's a token to show that not only we see what you're doing, we acknowledge the hard work that you're doing, and how us being able to do that impacts a day. It really can turn around someone's bad day into, it may not make it a good day, but it may make it just a little bit better than the day that they were having. And so the chaplains will have access to the cart. And my hope is that the cart is used at least 1 to 3 times per month per chaplain. Our administrative assistant and secretary and myself will help to make sure that the supplies are kept up to date. And so far, the units that have received items from the care cart, the bone marrow transplant and 4 North units at University, as well as 5 North, 5 South, MPCU, 3 East, the MICU, the TICU, and the EVS staff at University. And at Methodist, the units that have received items from the carts have been 6 East, 4 East, 7 North, NCC, B4, B5, C5, 5 North, and 4 North, 4 South, 6 North, and 6 South. And so as you can see, several of our units have been able to date to receive items from our Tranquility cart. And as I stated earlier, we did want to make sure that we are aligned with our IU Health values. And so the purpose, working to do good in the lives of all others. And so we want to make sure that we are doing that and that we are helping our team members to be in an emotionally healthy work environment. And then excellence, doing our best at all times and in new ways. And so by offering a much needed moment just to say thank you, just to say we see you, and just to show you by offering a resource in addition to candy and essential oils, but also if you need to reach out to EAP, here's the card or the brochure for them. Or if you need to talk with us while we are on the unit, I'm here as well. And then compassion, showing compassion to our team members. And then team, being a supportive and a caring presence. And so the cart is something that is tangible, that lets our team members know that they are valued. So challenges and learnings. One of the challenges is finding the right type of cart that meets the needs and is safe. Before I ordered the cart, I checked it out with the team, with the staff chaplains, and some of the concerns were the wheels. We have to make sure that the wheels are not, that they're safe going in and off the elevators. Because again, the last thing we want is for a chaplain to get hurt trying to push a cart onto an elevator and something with the wheel gets stuck in the grooves of the elevator, and that could be a catastrophe. And so I am working on trying to find the right type of safe cart. So that's one of the challenges right now is, so the items are being taken out to the units, but they're not being pushed on a cart. And then another challenge is staff chaplains having the actual time to be able to take the time to take the items to their units. If we don't have appropriate staffing that could ensure that patient care is not being neglected while we're doing this. So just finding the right balance for this. And then a couple of other learnings that I've learned is that carts are not allowed on our behavioral health units. That was a learning for me. I did not know that. And so I was very, very grateful for Kiona, who is one of our chaplains that serves on the behavioral health unit. And so as for safety precautions, they are not allowed. She can take items to the unit for the team members. It just can't be in eyeshot or in a place where patients can be. And then the other learning is that not all carts are user-friendly. And so while a cart may look nice and it may look like it would be perfect for us, it just may not be user-friendly. And so that has been a couple of the challenges that I have learned. And then another challenge is how to do the QR code and the surveys, because when we taken around the items, sometimes the items are left, or sometimes we are just passing them as we're going through the unit. And so trying to figure out what's the best way to capture a survey to get the actual outcomes has also been a challenge. And if anyone has any questions for me, I will attempt to answer them. And I'm going to stop sharing so that I can see everyone.
Thank you so much, Lynel. Interested to hear any questions from anyone here.
Thank you, Ms. Lynel. I have a question. I really didn't pick up why the cats are not allowed on the behavioral health unit. If you can help me understand.
Yes, for safety reasons, the cart is not allowed on that unit. The items can be taken to the team members. We just can't push the cart on that unit.
Okay, thank you.
You're welcome.
And Lynel, this is Gloria. How are you taking the items then if they are not on a cart? Do you have like a basket you're carrying, or how are you transporting them now?
Yes, so there are, we have baskets or bowls that staff are using. And also we do have a cart, a push cart that staff have access to. We just don't have the actual cart for this grant that I had applied for. But there is a cart and bowls and baskets.
Lynel, is there an introduction when you're on the floor? Do you say, I don't know, card on the floors or something? Is there something that gets their attention? I don't work in the hospital. I'm just curious.
So one of the things when the staff chaplains are taking items around, the attention, they catch their eye. So when you have chocolate, people will pay attention. And I'll ask if any of the staff chaplains want to pitch in and say, how do you, to answer Joe's question.
When I take it onto the floors, just having it there and them seeing you is enough for everyone to start coming over. And really the nurses will share with other nurses, like the chaplain's here, the care cart's here, come get like snacks. So it's pretty quick. And when I was at Riley, which is different, they also would sometimes use their voceras to say, chaplain's here with a care cart for anybody who can come over. So just spreading the word pretty quick takes place.
Thank you, Caitlin.
This is Diana. I've often taken up treats in a bag that I just carry around so I can give them to each of the staff members that I see. And as soon as people see the bag, the word spreads. I don't even have to say anything. They just see the bag and they say, oh, you've got the bag with you today. You've got the goodies. So yeah, just like Caitlin said, getting the word around is never a problem.
Thank you, Diana.
So when I was at university as well, as soon as I entered the room with the CVS staff used to meet, as soon as they see me, they know, and they see me with the bag, they just walk up and say, oh, thank you, chaplain. And then they have breakfast before even the huddle. I didn't have to say, come on, come on. I didn't have to invite them. When they saw that bag, they know they had something to eat. So thank you.
All right, so maybe I need to get more bags.
Yes, that's what I need to do. Thank you.
More user-friendly bags or carts or, yes, Alan.
I was just going to add it makes us really popular too on the floor. So it's an extra incentive.
Awesome, thank you.
Prior to this grant, I took treats to one of the floors after a code. And one of the floors I was able to like sort of go door to door when nurses or other team members were in the hallway and catch them that way. And I made my way all around the unit so folks could see me. On an ICU, actually the charge nurse and clinical manager asked me to take it to the break room. And then they went around and told folks that they could come to the break room. And then I had more opportunities for conversations with people because they had stepped away from their bedside briefly. So that was really helpful.
Yeah, thank you, Shelley. Well, thank you all so much. And I definitely appreciate being funded the grant and look forward to at the end of the year. I'm not for sure, Gloria, how often you all get updates, but we are very grateful for that we were one of the recipients of this grant. And so thank you all so much for approving the grant and working with me, as this was my first application, and so still learning through the process. So thank you so much.
I'll keep in touch, Lynel, so no worries.
All right.
Thank you, Lynel. All right, Kelsey, you ready to share your project?
Yes, absolutely. Let me pull up my PowerPoint here. And is that what I want? Okay, can everybody see it? Okay, I think I see heads nodding. So once again, I am Kelsey Miller. I'm the manager of the Department of Clinical and Organizational Ethics. So for today, I will give you an overview of the program and the program's objective, a little background as to how I got here, some data points that I've gathered, some challenges that I've faced, and then I will also have time for questions at the end. So the objective of this program is to offer supportive measures to families of trauma patients who are actively dying or have a potentially life-limiting condition. And it's meant for families who are in the trauma center at IU Health, at the Methodist Hospital at IU Health. And so just a little bit more background. When I was in grad school, this was like my capstone, my thesis project. So I had a lot of designated time to do all of the research and gather all of the info that I needed to support this idea. And during that research, I found this quote that says, at the end of the day, people won't remember what you said or did. They will remember how you made them feel. And I thought that that was such an incredible quote to share, and that would help support this program. So a little bit of context. This is my husband and I on the left, and then my best friend Shelby, and then my husband's best friend Zach on the right. This was in 2018. We went on vacation together in Mexico. They are our best friends. We all went to high school together. We moved to Indy around the same time. And my husband and Zach worked at the same company here in Plainfield. So we've just grown up together, essentially. So in 2019, Zach was on a small private plane going to a construction job site in Michigan, and the plane crashed and he passed away. So when the accident happened, of course, all of family and friends rushed up to Michigan to be with Zach at end of life. And while we were there, we were just blown away by the support that we were given as family and friends, such as we were there for days. So they gave us a conference room to sleep in until we were able to secure hotel rooms. They brought food from the cafeteria. So we had fruit trays and coffee and water. They gave us meal vouchers. I don't think I paid for a single meal while we were there. We didn't pay for parking while we were there. So it was just such an incredible experience for us in one of the most traumatic times of our lives. So that's where this idea came from. And my undergrad is in hospitality. So it was kind of a way of merging my hospitality degree and my healthcare degree, and bringing in this experience that I had in my life. So there's I kind of see it as two different things that the program provides. So we have a comfort cart, and then we also have services that we can help provide. So the comfort cart includes a lot of toiletry items. If you think, if you've ever been in this type of scenario, when you get that call that your loved one has been in a car accident or whatever the case may be, you don't think about getting your toothbrush in most cases. You just get out the door and get to the hospital. So a large part of the supplies on the comfort cart are toiletries. So toothbrushes and toothpaste, deodorant, body wipes, combs, lotion, contact cases in solution, dry shampoo, because there's not really a great place for you to go wash your hair unless you do it in the sink in the bathroom, and that's just not ideal. Eye masks, blankets I've recently added. And then there's also some snacks and drinks, granola bars, chips, pop, water, and then other I call them activities, but things to just kind of take your mind off of what's going on. So puzzle books, playing cards, and then also phone chargers for iPhones and Androids. So this is the cart. And you can see here, the big part of the cart is the activities and the snacks. And I'm kind of OCD, as you may be able to tell. So I went crazy at the Container Store, trying to find the best, the best ways to organize this cart to be able to include as many things as possible. And then these three pictures on the right are the body wipes. I did include little zip bags, so families could make their own toiletry bags if they wanted to. I could have purchased toiletry bags pre-made, but not everybody's going to need all of the things that come in a toiletry bag. So it seemed like a little bit of a waste to purchase those. So that's why I purchased these things for them to kind of do a build your own bag. So we've got toothbrushes, toothpaste, body wipes, deodorant, lotion, eye mask, combs, and then like I said, dry shampoo, contact solution, all of those things I've added after I took these pictures. But I will talk more about the cart when I get to my challenges. And then the other part of the program are the services that we provide. So of course, these services are in collaboration with other departments across IU Health and their support. So chaplaincy, they're there, for that bereavement support. Thomas McDore has been a huge part of this process, and he has he's in charge of, and I don't remember what it's called, and this is horrible. He's in charge of basically receiving donations of clothes for people who get to the hospital and they're covered in blood or whatever. So for those people, they can get a fresh set of clothes, so they're not sitting there covered in blood. So those are available by chaplaincy and to those family members who need those. Food services, if you're with a trauma patient's family and death is imminent, you can call the food services department and ask for a bereavement tray. And I've been told that it's never the same. It could be fruit, it could be bags of chips. It just depends on what they're able to gather. And they can send that up for the family. Meal vouchers are going to be a service that's provided next year when I receive the larger part of my funding. And those will be able to be distributed to families who are in the waiting room or in the patient's room. Maybe their loved one is an organ donor and they're just waiting on IDN to show up, or, you know, whatever the case may be, they're waiting for more family to get there to say their goodbyes. So they're going to be there for 24 more hours. So providing them a meal voucher so they don't have to worry about how they're going to pay for it or have to worry about any type of financial issues in that moment. Along with parking validation, I think it's crazy that we pay or that we have paid parking, but that's it is what it is. So I'm hoping to be able to provide parking validation to these families as well. And then also being able to connect the families with the guest relations or the info desk team members to help them find a hotel if they're from out of town. That way they don't have to sleep at the hotel or at the hospital, and they can go get a good night's rest if they are willing to. So now we'll talk about the process of it. So I said that Thomas McDore has been a huge part of this program. Excuse me, but it's also the on-call chaplains in the trauma center who have been a huge part of this program in the process and the implementation of it. So the on-call trauma chaplains are who basically decide what family would benefit from the supplies or the other services that the program provides. So when the on-call chaplain identifies this family, they can bring the comfort cart up to the family on the trauma floor for them to select supplies. And then they can determine if any of the services would be beneficial to them. And then after the family selects the supplies, I just ask the chaplain to complete a data form that is on the cart. It's a QR code similar to Lynel's for me to be able to track data. So it's not a long drawn out process, but I acknowledge that it's another thing that I'm asking team members to do, to take time out of their day to do. That's not technically a part of their job, but as someone had mentioned, it makes the chaplain look good, right? So hopefully it will help the chaplain and that family build a relationship, and they may feel more comfortable with talking to the chaplain. They may feel more comfortable asking for more grief support, helping to, bridge that relationship to help the family in other ways, not just by providing toiletries and snacks and meal vouchers. So these are the data collection points that I ask the chaplains to collect. And so it's not a lot, but once again, I acknowledge that it's something that takes more time out of their day. And unfortunately, IU Health likes reportable metrics. And as frustrating as that is, I can see now from creating this program and thinking about sustainability, I can see now why they make such a big deal about reportable metrics. So I can appreciate that a little bit more now. So very simple, straightforward, to the point. So now we'll talk about some data that I've received. So let me pull up my notes here so I can get this correct. So as of September 19th, there have been at least 32 people who have benefited from the program in one way or another, mostly from the comfort cart. There have been times where I come into the office to, like on a Monday, and I go to where the cart is stored, which is in the on-call chaplain's office, which is connected to the chapel. I go to see if the cart was utilized and to restock the cart if needed. And I have gone to do that. And I've noticed, like, I think at one point the cart was almost completely wiped out, which is great, but there was no data form submitted. So I acknowledge that these numbers are likely under representing the actual number of people who have utilized the cart. There are 3 different chaplains who have utilized the program to help provide these supportive measures to families, and some of the chaplains more than once. So some of the supplies that have been taken from the cart include toiletry items, including toothbrushes, toothpaste, deodorant, body wipes, Kleenex, snacks, chips, granola bars, sandwich crackers, soda and water, and a lot of phone chargers. And one of the services that have been utilized was the bereavement tray. So it's nice to see that the on-call chaplain was able to work with food services to get the bereavement tray for the family. So at the beginning of my project, I met with Lexi, Dr. Torkey, and Gloria, and I had told them that I was having a hard time trying to figure out how I was going to report demographics of the family, mostly because it's not always, race and ethnicity aren't always the same for the patient and the family. And it's also not really appropriate in the moment to ask a grieving family their demographic info. It seems inappropriate and just not right to do. So I guess icky is a word. So I received IRB approval to obtain the patient's demographics from their medical record. And I just make an assumption that the family members have the same or similar demographics as the patient. So I asked the chaplains to just provide the MRN of the patient whose family received services or supplies from the program. And then I go into the patient chart and collect what we call pearls. So pair, ethnicity, age, race, language, and sex or gender of the patient. So that's what I have to show here. So 100% of the patients were not Hispanic or Latino. 25% of the patients were Black or African American, while 75% of the patients were white. We have, I apologize, my numbers aren't adding up to 100 here. We have 50% male, 50% female. And then I think I asked the chaplains to provide a brief reason as to the hospitalization, but I can also pull that from the medical record too. So half of the patients were fall patients, and then half of the patients were in car accidents. So I have faced some challenges. And one of those pieces is data collection. So because I'm not the person providing these services or supplies to the families, I have to rely on other people to complete the collection form. So like I said, it's up to the trauma chaplains to determine what families could benefit from the program. So it's up to them to complete the form. on top of what they're already doing. And I imagine in the trauma center, it's a heightened level of anxiety and all of the things. So just asking them to do another thing is probably frustrating to them. And I can acknowledge that. But that is a challenge that I'm facing, and I have reached out to them and kindly begged them to fill out the data collection form without seeming like I'm crazy. Maybe they think I'm crazy, I don't know. But so it's something that I'm hoping to improve upon in the future. Sustainability isn't a right now challenge or concern, but something I'm keeping in the back of my mind. I have created Amazon wish lists to share with people who want to donate items. So the program can, be sustainable. And I have had like 4 or 5 donors so far, and it may be like my parents and my family, but doesn't matter, donors are donors, right? But the concern in the back of my mind surrounding sustainability is the lack of data that I have collected so far to be able to prove how beneficial this program is, to then be able to request more money or more grant money in the future. Similar to Lynel, a challenge that I have come across is the bulkiness and weight of the comfort cart. For some of the chaplains, it's not the easiest to push around because it is bulky, and now that I have it loaded down with all the supplies, it's kind of heavy. And then also to get on and off an elevator and take up to another floor and all of the things. So I have since purchased baskets that I leave out on top of the comfort cart for the chaplains to just take a few of everything that's in the cart, or if it's a chaplain who knows the cart well, they can tell the family what's on the cart, and then they can just grab the things for them and take up to the unit. So that helps with them not having to push the cart around. I worry also that because the cart is not necessarily in a location where they can easily just like open a door on the trauma floor and grab the things and take to the family, that because it's, on a different floor in a different area of the hospital, that it might not be getting utilized as much as I had hoped. But that's just the way the cookie crumbles, I guess. And if we can find a different place for it, that it would be better utilized. I'm always up for suggestions, but this is the best idea we had come up with so far, and it's not the end of the world, but I do think it may be a challenge. I'm sure there are other challenges that I'm blanking on and more challenges to come in the future, but these are the few that are at the forefront of my mind right now. So on the flip side of that, I wanted to highlight a couple of things that are positive outcomes from the program so far. Some of you may have seen that I was interviewed by the by the IU Health PR team, who created a really nice video to share, and they shared it on the daily, and that was really cool. I was also reached out, the director of experience design application for the South Central region reached out to me to discuss how the program operates, and basically to see how they could think about implementing it or something similar to this program in the South Central region. So that was really cool to be able to share what we're providing, and just be able to talk through with them what they think would work and give them some ideas on what they could do and how they could be successful in the South Central region. So we'll end on a semi-good note by reading through some of the impact statements that the chaplains were able to capture while providing the services or supplies of this program to families. So somebody had said bringing a snack to the husband allowed him to stay on the unit instead of going down to the cafeteria while transitioning to comfort, which was imminent. Families seemed grateful and stated their thanks several times. And then the patient's brother shared his gratitude several times and seemed to share that he and his family felt seen following a long night and long commute to the hospital. I've often said when people ask me how I see this being successful, and I always just say, well, helping one family is successful in my eyes, but now that we've helped people already, I'm getting a little greedy and I want to help more and more and more. But with that being said, I feel like this has already been a huge success, and I'm very grateful for receiving the grant and being able to provide such a valuable program, but services and supplies to family members who are going through a similar experience that I went through, and knowing how much I appreciated that in my traumatic time in my life is just really important and I think powerful. So I'm happy to take questions.
Hey, Kelsey, thank you. I have a quick question. Actually, I think I have two. You mentioned trauma chaplains. I think you stated that the trauma chaplains have to be the ones to recommend the family, or so can you explain that part for me, please?
Yeah, so it's just I guess assumed that at the end of life, when the clinical team realizes that a patient's at the end of life, they might call a chaplain to come see if the family would like to talk to them, to offer bereavement support, grief support, and whatnot. So in that moment, the on-call trauma chaplain could, when they meet with the family, identify if they have any needs at that point. And that's kind of how I see it happening in the beginning. Once hopefully the program's pretty well known and the team members know of it and know what we provide, I'm not opposed to them then, asking the family if they need any supplies or whatnot. I think it was just the easiest way for us to kind of get in the door. And honestly, Thomas has been working with me like from the beginning on this. I think I presented this to him in the midst of COVID. I was still in grad school. I was like 17 months pregnant and it was COVID. And I presented it to him in October, and then I went on maternity leave in November. And so we weren't able to like pick it back up until earlier this year. And Vern was like, you should just apply for the values grant. And I was like, yeah, okay, whatever. Not thinking, I'd actually get it. And then when I got it, I was like, oh my gosh, how are we going to do this? Let's figure this out so we can get it off the ground like June 2nd, right after we get the money and da 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 da. And so then we had to just like slow down and think about it. And I think this was just kind of the best way that we thought it could be implemented. But I'm open to recommendations and changes.
Well, you and I, we can set up a time where we can meet, because so I know it's a very complex system. And so Thomas is the only trauma chaplain that we have.
Right.
And there may be a trauma fellow, at a point during this year. Last year it was Linda Coots was our trauma fellow. So we had a trauma fellow, and then Thomas is the trauma chaplain. So those are the only two designated chaplains for trauma. Eric Williams also has the emergency department as one of his clinical units as a chaplain, but we all of the chaplains at some point will respond to the emergency room for traumas. So it can be kind of confusing, that whole thing. But I know that the chaplains that have utilized the supplies have spoke highly, that the families really appreciated it. And so just wanted you to know that it's a good project. I think, you know, more work to come. Thankfully, we're just 3 months in. So that's a good thing.
Yeah.
Thank you for your presentation.
Thank you.
Kelsey, I just want to say that it's really incredible that you've used your own grief to help others, and this is a really great program. My question for you is just curious how you are getting this information to the chaplains. And I'm especially thinking about our chaplains who might be on call there on the weekend, who are students who might be at different hospitals during the week, but then they're covering at Methodist on the weekend. And so I'm curious about your process and how you've included getting that information out.
Yeah, thank you for that. So there have been a couple of things at the very beginning of this. I met with a group of chaplains. I think it was during Lynel. What was that meeting? Was that just like a staff meeting that I came and spoke with you all at? Do you remember?
Yes, it was one of our 1215 huddles, one of our meetings. Yeah.
So I was able to share with quite a few chaplains in that moment. I'm really hoping word of mouth is another way of kind of promoting the program. There are flyers in the on-call trauma or the on-call chaplain's office. That is where the cart is being stored. I think Thomas has put flyers up other places on the unit maybe. And I have recently also gotten with Lynel and other, thanks Lynel, other educators who shared with me the residents' names and fellows' names so I could share the program with them just via email. So, I mean, if there are people who aren't aware, I'm happy to speak with them. I have created a brochure, a flyer that I share, that I can share, and it like is just a high overview of what the program offers. So at least getting it out there and in the back of people's minds.
Thank you so much, Kelsey. And I missed saying thank you to Lynel, but it's 3:01. Kelsey, if you have a few minutes to stay after for people that want to stay after, that's great. But I wanted to thank everybody otherwise who's been here and listened, and for these two great projects and presentations.